So the thing that happens with Claromox is that it comes as a powder form. And essentially what you have to do is you have to reconstitute it, so you have to mix it with water. So I already did that for the first one, which is this one. You probably have enough to go through for like the 2 weeks, but unfortunately, because it's reconstituted, it's only good for 10 days.
Okay.
That's why we're sending you home with a second one, because you're gonna have to, after those 10 days, you have to reconstitute the next bottle.
Okay.
And I'll show you how to do that.
Okay.
But essentially, this one is already a liquid form. You just have to refrigerate it when you get it home. And you'll start off. Once you get to the 10-day mark, you're gonna take the new one. And actually, it has instructions back here, but essentially, what you're gonna have to just remember is you have to have 14 mLs. So I'm gonna get a syringe for you. You're just gonna mix it with just 14 mLs of just regular tap water in the new bottle, the one with the powder.
So you mean 14?
I'm gonna give you a different syringe. This is for you to give the medication.
Oh, okay, okay. Thank you.
So don't worry about that.
Oh, okay.
We'll come back to it in a sec.
14 water.
Yeah, so I'm gonna give you a big syringe for you to fill with water, and you're gonna add it to this bottle here with the powder, the one that has the powder. And then you'll start doing this one after 10 days.
Oh, okay. Okay, I just put the water inside that box. Oh,
and then just shake it.
Okay, that's easy.
And then refrigerate it once you do. For now, since it's in the powder form, it could be left out in room temperature.
Okay. Okay.
And then for how much you're gonna be giving, it says it on the label here, it's gonna be 1 ml. So these come in 3 mLs. So what you're gonna be doing is you're gonna be drawing up to the 1. And this is the amount you're gonna be giving every 12 hours. Okay, so twice a day. With this one, if you give it on an empty stomach, it will cause like stomach upset. So you just have to make sure that you give it with a meal.
With some, okay.
Yeah, so usually I would say give the food first and then just give it afterwards. Okay. That way you know that there's something in our system. Okay. You could give it under an empty stomach, but almost every single animal is gonna start having some diarrhea, some vomiting if you give it on empty stomach. Okay. It's very harsh. It's just like us. If we take antibiotics, it starts hurting our stomach.
So you mean this one's supposed enough for 2 weeks, or the both?
No, you would use both of these in 2 weeks.
For 2 weeks, okay.
The first one is only good for 10 days, so just give it for 10 days. Okay. Unless you run out. If it gets to even before that, then you could just start using the new one.
Okay.
If you run out before the 10 days, you can start using the new one. But if it's 10 days and you still have some left over, just throw it out. Even if you have some left over, because it's not going to be good.
Right. Okay, exactly. Okay, thank you. So I'm waiting for...
I just have to get you a syringe.
Okay, thank you. Beautiful. That's cute. Christmas.
This way.